Hello and good morning, dear viewers. You're most welcome to the DAKTARI show here on West Nile TV. And this is a healthy show which airs every Thursday from 10 a.m. to 11 a.m. where we bring you experts in the medical field, doctors, nurses, therapists, dietitians, and also psychotherapists who come and educate you, our viewers, on how you can manage your life. Because this management, you can use it to solve some economic crisis whereby you will not get some sicknesses, and this will help you cut expenses you could have spent on medical bills. With us today we have again Dr. Ronnie Mobutu, who is going to introduce himself. Last time we took her through diabetes, and today is yet again to take her through an exciting topic regarding asthma. And he will take her through what asthma is, the various types of asthma, the triggers of asthma, how can we manage people with asthma, and also in case you get an attack, how can you help someone with an asthma attack. Then also in regarding to our fellows who are having asthma, how can you live a life, your life healthy with asthma. Once again, you're most welcome to the DAKTARI show, Dr. Ronnie Mobutu. You can introduce yourself to our viewers.
Thank you so much, Mr. Moderator. I'm happy to be back again to share on this very important topic of asthma. Asthma is not new to us in this community. It's been with us for such a long time. Either a friend or a family member or a neighbor is having asthma, either at workplace or in the neighborhood or in school. So it is important that we really have to share about asthma so that we can be able to manage our lives better. But what is this asthma? Asthma is a chronic airway disease. It's a chronic airway disease. It manifests by one, difficulty in breathing, recurrent cough, recurrent wheezing. Actually, we easily know asthma by that peculiar breathing, that noisy breathing, like a pusscat has sat in somebody's chest. Then you know this person must most likely be asthma. By the diagnosis, even medically, is made by hearing those stories. I breathe like there's a pusscat sitting in my chest. My cough is recurrent. It's never ending. I've used every man of treatment. It's not coming to an end. Then we begin to suspect. In that way, we begin to suspect asthma. So basically, that is what asthma is. And then, of course, the patients then present with as I said, recurrent coughs, and then difficulty in breathing. And then the difficulty in breathing could be so much that this person ends up sweating and the chest becomes so tight. I talked about recurrent cough. This cough is actually dry, it's not productive. You cough, but there's nothing you spit out. And so that is how asthma will present. A person with asthma will present. So it is important that when you identify yourself, if you've never been known to have asthma, the signs and symptoms that I've talked about, if you're having them, or you have a neighbor, or at your neighborhood somebody is having it, you begin to fear that, okay, this could be an asthma, and this person needs to seek care in a health facility or by a trained medical worker so as to be helped. Thank you.
All right. Thank you very much, Doctor, about that discussion. I heard you say chronic. So someone might be wondering, what does the word chronic mean?
Oh, okay. Thank you so much, Mr. Moderator. Chronic actually means recurrent, repeated. It comes again and again. You may cough today. Most of these triggers usually come in the night. Okay. Yeah, chronic cough is a cough that is persistent and recurrent. And usually in asthma, it often comes in the night. So that is a chronic cough, a repeated cough, recurrent, and persistent. Thank you.
All right, thanks very much, Doctor, for taking us through what asthma is, and you've told us it's a current cough mainly sometimes. Maybe people outside there may be asking, does it have classes or types?
Yeah, certainly.
Okay.
Certainly. Asthma can be classified in many ways, but I would limit it to this. You can have a mild asthma or a persistent asthma. The mild can be mild intermittent. Mild intermittent means probably you're just having asthmatic attack like less than once in a week, okay? Or less than once of those asthmatic attacks in a month. So in the night symptoms, we did say the symptoms include the recurrent coughing, difficulty in breathing, wheezing. So if you're having this kind of presentation just less than once in a week, then we think that is just a mild or mild intermittent asthma. But then you can have persistent asthma, which is also mild. Yeah. So in the mild intermittent, the person can do activities normally like anyone else who does. The person is like anybody else who has not had an asthma or is not having the condition. But then mild persistent means that more regularly you may need to be using an inhaler, especially the salbutamol inhaler. So the condition comes at least more than once in a week. So here somebody is mild, but it is persistent. So you can also have a moderate. Yeah. We have persistent, moderate, and persistent severe. So in persistent moderate, the patient is having more than 2 attacks. His work is affected. Yeah, his work is affected, and he's on salbutamol. Maybe we will even need to add another regimen of care that could be a corticosteroid, an inhaler. And so in severe, these patients are usually now those ones who come to the facilities. They may not be able to stand the care with salbutamol or the corticosteroids from home. They may need a very close watch from the DAKTARIs, and probably most of them come when they are in exacerbations. So basically that is the different types of asthma. For us, especially we categorize that so that we can tailor care for the patient. Otherwise, I know some others could be categorized according to the triggers. Others are, for instance, if yours is induced by an exercise, you think it is an exercise-induced asthma. If it is triggered by maybe upper respiratory tract infection or flu, maybe then we can also categorize according to what is triggering your asthma. But for care for DAKTARIs in the hospital, usually what I'd said, because it gives us the level of how needy each patient is and what kind of care we can be able to offer. Thank you.
All right, thanks very much, Doctor, for that discussion on the types of asthma we have. So maybe viewers may be asking, are there triggers of this asthma? Some people be there, they say maybe in the cold, it's the one which makes them to do what? To get that attack. Are there various triggers which can be or expose someone to get these asthmatic attacks?
Thank you, Mr. Moderator. Certainly there are triggers. Whereas the cause of asthma is not known to doctors as it is now, but at least we know triggers of this asthma. One of them actually I'd said earlier on, it could be another respiratory tract infection. For instance, flu. Flu can trigger repeated coughing, wheezing, difficulty in breathing. And so if somebody has asthma and gets an infection of flu, then that can trigger his asthmatic attacks. But also, people respond differently to different conditions. So one of the triggers could be just an exposure to his environment or her environment. If either it's cold, cold can trigger hyperactivity of the airway, because what actual asthma is the hyperactivity of the airway, the chronic hyperactivity of the airway. So that chronic hyperactivity of the airway can be triggered, for instance, by different substances in our environment. One of them, as I said, could be pollen. It could be even smoke, cigarette smoking. Somebody smoking near you can trigger the exacerbation or worsening of your asthma. And then also inhaling dust could trigger a hyperactivity of the airway. And if that is triggered, then it exacerbates or worsens your asthma. If you're contained of your calm, then exposure to such an environment can easily trigger. As it said, exercises. Some people's asthma is triggered by exercises. So the exercises that you engage in can predispose. So different people are triggered. Their asthmatic attacks are triggered by different activities. So then it is important that you know, if you're asthmatic, you get to know what actually triggers your asthmatic attacks. So that is very important to know. There are so much that maybe we do not even know all the triggers. We usually ask, before this attack, where were you and what happened? So these are the things that we get that may be able to give us an information on the triggers. But as far as we know, those are some. But also we said, as one of the causes could be hereditary. Somebody has just inherited a gene from the parents who maybe have been asthmatic. And so, as we said earlier with the diabetes, the fruit never falls far away from the tree. And so if your parents were asthmatic, there are chances that you inherit the genes that make you inherit the genes of high hyperactive airway. And so if you inherit those genes and on exposure to any of these triggers, your airway can become hyperactive, and therefore you fall prey to this condition, the asthma. Thank you.
Okay, all right. Thanks very much, Doctor, for that discussion regarding the triggers of asthma. So you have given in that medical aspect view. Some people believe this asthma is contagious. Like in case you meet someone who has asthma, you touch the person or you breathe in the air this person is breathing in. Like if you don't keep social distance, these people like you can get this asthma? Is it true?
Certainly not. Asthma is not contagious. You don't get it through contact or sharing the same air that you breathe. It's not that way at all. As we said, the real cause is not known. But asthma itself is simply the chronic inflammation of the airways. So if you happen to have if you're unlucky that your airways are easily triggered, irritable to different substances, irritants, or as we said, even the diseases like flu, then if you're having that recurrent, that's how you get, which means you have some genetic predisposition to this. Okay? You have a genetic predisposition to this. But otherwise, if you're sharing a spoon with asthmatic patient, no, you're not going to contract asthma through that. Or you're sharing the same room with the asthmatic patient, you're not going to get asthma through that at all. So I think it should be clear that it's a chronic condition. You may be predisposed because of your genetic makeup. Okay? Our genetic makeup is gotten from our parents. So if their genes had easily succumb to exposure to different irritants, especially the airway, and therefore they're having this presentation of recurrent cough, wheezing, difficulty in breathing, and then I think that is how we usually contract how we get the disease, but otherwise, you don't get it by, as you said, you don't get it, as the myth goes out there, by sharing any foods or containers or rooms at all. Thank you.
Thanks very much, Doctor, for that discussion and clearing the air, because most people in the community there thought it is a contagious disease, like when you touch someone with it, you can also contract it. Yeah, thanks very much, Doctor. So also you talk about signs and symptoms like the breathing, where you said it may be recurrent, like rapid. You also said these people also sometimes get recurrent cough. So suppose we are in the community and I find someone who has gotten an asthmatic attack. How can I help this person, even if I'm not a medical personnel?
You meet with any person who has gotten an asthmatic attack. He's wheezing, he's finding difficulties in breathing, his chest is congested. One of the first things to do is to ensure that his airway is open. And so if there are secretions that are coming through the nose or the mouth, we ensure that we take rid of that. But also then we have to tilt the chin. We lift the chin up. When you lift the chin up, you're actually trying to open the airway to give room, because when the neck is bent like this, it closes the airway. So you raise it. You lift this chin up like this to enable airway. But find every means possible to rush this person to the nearest facility for care, because that means that asthma cannot be managed in the community. And if it's a cold day, make sure that you add some clothes on this person. You keep this person warm as you transport to the hospital, and find every to rush the person for care. Thank you.
All right, thanks very much, Doctor, for that discussion and giving guidance on how our people in the community can help someone who has gotten an asthmatic attack. Maybe, Doctor, which medications, not mainly, I know you may not tell it to our viewers, but like you can tell us, what do these medications do to these people? Like, an asthmatic patient takes them. How do these drugs help make the life of this person better or relieve these signs and symptoms? As in the next segment, you're going to take us through the use of an inhaler. Thanks very much.
Thank you so much. Indeed, there are many drugs that DAKTARIs use, but also there are those that we give out to the patients they can use in the communities, Mr. Moderator. And you've asked me to list some of the drugs. One of the most common one we use is actually the salbutamol inhaler. If somebody's asthma is in a category where he's not in severe attack and you're feeling your chest is congested, you're beginning to find difficulty in breathing, you can actually get your salbutamol inhaler and take a puff or two. And then you give yourself some time. But also, most importantly, is by there to identify the trigger. Because that attack or exacerbation or worsening of this asthma could have been triggered by something within the environment. So you find yourself, you should move away. If somebody is smoking nearby, you ensure that you move away from the smoker. If the room is dusty or where you are is dusty, you find yourself, you have to move away. And so that's how the care begins. And then, as the situation worsens, if you're beginning to have more of these symptoms night and day, and besides your salbutamol inhaler, you've been given a corticosteroid inhaler, you puff these inhalers. But usually, you do not have to delay. You've got to come to a facility where a professional can begin to help you. The earlier you come, actually, the better. Don't come in so much worsening situation. So if you arrive and your breathing is like the one of a postcard with lots of noise, the DAKTARIs will know what to do for you. Usually they run what we call a nebulizer. They deliver that salbutamol now through an oxygen machine, directly into your what? Into your airway. And that will help to open up the airway. You actually had asked me, what do these medicines do? They open the airway because in asthma, you're having chronic inflammation of the airway, and that constricts the airway. It narrows the lumen, the pipes that deliver oxygen to the lungs. It narrows them, and it doesn't only narrow them, but also it swells. It swells, and usually we call that edema. It swells and creates what we call as edema. But also then the inflammation. That inflammation triggers the airways, and then the edema is contained, is reduced or eliminated, and then if the airway is open, then you can be able to breathe. And then also the production of the mucous membrane is tapered down. And usually that's the work of the salbutamol and the corticosteroids. We can have them in a different formulation, but of course the preferred mode is the inhalational mode, because it delivers these drugs direct at the site of what? Of the disease, where there is constriction, there is the edema, and there is production of the mucus, which actually is the reason for difficulty in breathing, noisy breathing, and also recurrent coughing. Recurrent cough, the body is actually trying to expel away those mucus plugs so that it can find a way. It's like the mucus blocks the air entering, so the cough is there to clear that airway so that it gets it off, so that it can allow air enter. Because we need, all cells in our body need oxygen. And so if the oxygen is blocked, the body fights vigorously to ensure that the airway is patent for the lungs to receive this air and extract oxygen from it and deliver to the different body parts for use. So asthma is a disease exactly that disrupts that normal process. And so the drugs that are designed to ensure that that pattern is restored. Okay? Thank you.
Thanks very much, Doctor, for the discussion on the various medication and how they work. Those who have just joined us, it's the Daktari Show, and today we have our guest, Dr. Mobutu Roni, who has taken us through a discussion on asthma, and he has taken us what asthma is, how can you identify someone with asthma, like you feel like your chest is arrested, like you breathe like you have a postcard in your chest. You took us through the triggers like pollen, dust, like our people here who are in the grinding millers, that particles which come maybe from flour, if they enter into your respiratory tract. Then you took us through these medications they use and how they work, that they open up our chest. We request you keep on. In our next segment, we are going to come with our guest, and he'll take us through how an inhaler works. Thank you very much, our dear viewers.
West Nile TV, lighting up the
A brand new Global Star TV with StarTimes Inside Technology. New TV innovation with an inbuilt decoder that connects you to both StarTimes antenna and satellite signal. With StarTimes Inside Global Star TV, you can enjoy over 300 local and international channels, 1 month StarTimes highest bouquet for free, automatic system update, more benefits, more affordable. StarTimes Inside Global Star TV is available in all StarTimes branches and dealers countrywide. StarTimes Inside, entertainment inbuilt.
celebration you've been waiting for!
It's Yunus Junior Santamu!
It's our league, our football, our boys, our style. Star Times UPL new season starts 15th September. Go for it!
What a finish from Ashraf Bukume!
The Ugandan flair, Brazilian samba, Portuguese magic, the night football craze. More TV games live on Senyuka Prime and Fufa TV only on Star Times.
The Star Times UPL. Our league, go for it.
West Nile TV, lighting up.
Those who have just joined us today, we have our guest once again, Dr. Ronnie Mobutu, and he has been taking us through asthma, what asthma is, the signs and symptoms of asthma. He took us through the triggers of asthma in case someone has asthma, which things can push you to get asthma attacks. He took us through the medications and how they work. Well, you are most welcome from that short commercial break, doctor. All right. So maybe someone may be asking, maybe the person came to the hospital, you found out that this person has asthma. We see you normally always give these people inhalers. Maybe the public may be to know, how can someone use an inhaler in case you have given it to them and they have asthma? Maybe, doctor, I have gotten like a challenge. How can someone, like I'm assuming a pregnant woman is in labor and she gets an asthmatic attack. How do you always handle such cases?
It's interesting. Of course, such a patient will be definitely in a hospital environment. I've had a privilege to observe 2 patients that have asthma, but luckily they were not in an attack. They have asthma, but they are carrying pregnancy. And so I saw the care for them. Most times, by the way, they were in the hospitals. Most times. Because usually people come to hospital to deliver. They come for the reviews, those antenatal care visits. As I said, I've had privileges to see 2 cases of patients with asthma that have come to deliver. Most times their time has been in the hospital. If they do not have the attack, actually, they can. Anyone else who is asthmatic, a lady who is asthmatic actually can carry pregnancy. It's clear. Having asthma does not mean that you cannot have the right to give birth or to participate in reproduction. Actually, they have a right. And once asthmatic patient conceives, then he needs more closer visits. We need to, the whole irony is that we need to know more about this condition. The triggers, whatever your condition, whether you're pregnant or not, we need to know more about it, and then we need to act on time. Acting on time has helped. So both were delivered through cesarean. I don't know whether these were delivered because they then had the attack, but in the hospital care, they can be taken care of because their airways can be protected because the hospital has the capacity and there are doctors around who can take care of that. Otherwise, if they do not have the attack, I guess they can be able to deliver normally. Thank you.
Thanks very much, Dr. Ronnie, for that discussion. Actually, me too, I was worried. I was wondering how's a woman, like, she's delivering and she gets that attack. Thanks very much for clearing. Now, maybe still on that aspect of giving birth, you said this asthma is hereditary. Maybe we get a new couple, they come to the hospital. Can they test whether these people are carrying asthma? Do you always test that, or that technology hasn't come out yet?
Thank you so much, Mr. Moderator. I did say asthma, the diagnosis that you have asthma is actually made by your presentation, the clinical presentation, the symptoms you have, and what the doctors see on you. Are you having difficulty in breathing? Is your cough recurrent and persistent? Are you wheezing? Okay, so those are the things that they use, even though there are some tests that they can be able to do in order to check. But then maybe that is good for DAKTARI. The peak flow rate can be established if after giving bronchodilator, salbutamol for instance, and that peak flow rate increases by 200 mils, then you begin to think that this person I'm dealing with could be a patient of asthma. Or also we can use what we call spirometry. After giving a bronchodilator, and then there is an increase of more than 12% in the expiratory flow volume, then you think we could be dealing with what? We could be dealing with the asthma. Also, sputum can be analyzed when we see a lot of eosinophilia, but this is more medical. But it's of course, important also for us to know information is not everywhere. And the CBC can be done, look at lines that are easily affected by allergies. It can be able to give you a hint that probably you're dealing with what? You're dealing with a patient, because usually we do a CBC if we think there's an infection process that is triggering your asthmatic attacks. So basically, to make a diagnosis or to point out that this person could be suffering from asthma, the diagnosis that comes out by what we hear from the patient. I've been having recurrent coughs that have persisted. This is a dry cough, and it is mostly at night, and I'm having difficulty in breathing. Then we take our diagnosis mainly from that. Thank you.
All right. Thanks very much, Dr. Ronnie, for that discussion. Though you said it was more medical, but you said information is necessary for our people to know. I hope our dear viewers have gotten to note that. Now, also, maybe, Doctor, we have someone in the community, they have asthma. You said it is chronic. I mean, these people always get this recurrent cough, and it is lifelong. It won't go away. How can someone manage it, like him or herself manage their life such that they can have a long life which is more healthy?
First of all, somebody who has asthma, it is important for that person to seek for more information. No information is power, and seeking the right information from the rightful people, and not hearsays by the roadside or from non-medical persons. It is important to seek for that information. Once you've sought for that information, then it is important to seek for care as early as possible. Okay? That is the best way of living with asthma. So if you've had information and now you're seeking care on time, then it is important to let people know, people especially you're with, to know that, I have asthma. Because there might arise a situation where the exacerbation or the worsening is so much that you're helpless and you just shock everyone, maybe at your workplace, at school, maybe even in your neighborhood or in the family, that now you have asthma. Maybe helping you might be late. Okay? It might be late. Helping people know that you have asthma is very, very important. Because, this condition, if air is not reaching into your lungs and air is not being delivered into the cells, you actually, even raising your hand like this is very difficult. That's why it is important that you know about it, and also the people around you know about it, so that when they see you a little bit unusual from the way they know you, they think, oh, you could be having an attack, and they can easily come to your rescue on time. And so that is important. So having regular visits and interactions with the people who know about this, especially the DAKTARIs, is very, very important to meaningfully and living healthy, even with this asthma. So, Mr. Moderator, I think the hallmark is that we should know about it. We should let people around us know about it, so that in case we're incapacitated, we're healthy on time. Thank you.
Thanks very much, Dr. Roni, for that discussion on how someone can live with asthma. Maybe as we're almost coming to the climax of the show, someone may ask, can nutrition, like the food I eat, affect my life, like improve my state?
Certainly, yes. By the way, one thing I forgot to say is that we also must learn how to use the inhalers. We must learn how to use them, because the few patients that I've interacted with, most of them have failed to use these inhalers appropriately. And so it's very important how to, if you must live well in the communities and be able to contain those small exacerbations or limit their worsening, you must know how to use the inhaler. And I met one recently who had used this, who was given, I think, one of the oral medications for this. We usually use it in the exacerbations to lower than the worsening of the inflammation. And we withdraw it. We usually withdraw it. And this is taken orally. It is an oral drug, this particularly called prednisolone. It's a corticosteroid. I was shocked to hear that this patient had used this thing for over 20 years. I had to battle to get them back from using this thing. And of course, we don't just withdraw suddenly. We now step it down and then eventually withdraw. But they couldn't believe that the patient can live without this. We usually use drugs and withdraw. Even the salbutamol, this inhaler, we don't use it always. If you're beginning to use it always, then that means that the category of your asthma is worsening. And so that is what I would have wanted to add onto. You'd ask me some question? Nutrition. Yeah, nutrition, just like anything, we are what we eat. You eat healthy, you remain healthy. Okay? Almost everything that we consume has a side effect. Even the food. But even the air that we breathe, the oxygen, is broken down in some cases, and we generate in the body what we call free radicals. And some of these foods that we eat, they bind these free radicals. Free radicals are things that went in the body. It could be iron, the oxygen, those elements. They continue to bombard the cells, and they could actually worsen the process of inflammation. And so if you eat well, and especially foods, especially fruits and the greens and vegetables, these are usually, we call them protective foods. They have an element to bind these free radicals. And so they can help to reduce the process of inflammation. So I think eating well is good, not only in asthma, but in every life. Okay? Thank you.
Dr. Roni, for this discussion regarding asthma. It has been an exciting one. I hope our dear viewers, you have gotten to note what asthma is, the causes of asthma, and all the triggers, and also you took us through the medications and how to use an inhaler. Actually, that was the point of emphasis, because we have our fellows, our friends, our family relatives there outside who have asthma, our viewers, and he emphasized on how to use an inhaler. Then also he closed it by giving the why you have to have good nutrition, like good foods, where you have to get proteins, carbohydrates, vitamins. Thanks very much, our dear viewers, those who have been with us from the start of the show and up to this climax. Okay, maybe Doctor, again, you also give like some share again for our viewers, those maybe who could have just joined in, how to use this inhaler, and also maybe you'll give in your conclusion remarks as we end the show. Thank you very much.
Yeah, thank you so much. For those who have just joined us, we welcome you for this show, and particularly now on the use of inhaler. One of the biggest challenges is actually how to use this inhaler. The people I've seen, almost all of them do not know how to use the inhaler. So I said, while you use this inhaler, when you get it, I'll ask my moderator to help me a bit. Once you get this is the inhaler. It will deliver your medicine through here. So usually we close the cap like this. So when you get it, you first of all shake it gently like this 10 times, and then you open the cap and you flush it out like that once. You can flush it again. You can do that for up to 4 times, but 2 would be enough. And then you bring this part through which the medicine is delivered into your mouth and make sure that it seals this. Usually I would do it like this. Just a moment. And so you deliver this medicine by pressing it there. But before you put it in, I'd said you first of all exhale. You breathe out the air completely from your lungs. And once you breathe out just like this, so all the air in my lung is out. Then I bring this medicine, I put it in my mouth, and then I deliver it. Once I deliver it, I hold it there as I keep taking it in slowly. You keep counting your fingers like this. 1, 2, 3. In your mind, of course, up to 10 to 15 times. And then you can breathe out slowly. Because the goal is to deliver this medicine into the lungs, where there is constriction. Where asthma has caused constriction, it has caused swelling, and it has caused mucus to block entry of air. So once this medicine is delivered there, it will open up the constriction, it will open up it will reduce the edema or get it away, and then it will reduce the mucus that's being generated. And so there, it will open up the airway. And you do that ensuring that your chin is raised so that the airway is open through to your lungs. So that's what we shared here. And always seek to find a better information. If you will, you can actually look for us and we train you how to use it. After all, it's for free. We're not going to charge you to how to use this. But you can seek, I'm sure if you seek any healthcare facility, they should be able to help you how to use this inhaler. So one of the biggest challenges is failure to not knowing how to use it well. I'm sure from now on, for those who have had the opportunity to be with us today, you should be able to know it better. But if you forget, we are still available. You can seek us and we can help you to use this. So my conclusion remarks, I am very grateful to West Nile TV for giving us an opportunity to share key information pertaining health of people, especially with our people in West Nile, and who are listening to us elsewhere too. I'm sure because of social media, people listen to us everywhere. So this message is important. We pray that you seek it. It is costly because what is more important than health? There's nothing. If you're healthy, you're capable of doing anything. So it is important to seek care, and then especially that West Nile TV has given us an opportunity to get us informed of how best we can manage ourselves. So let's stick there. Thank you so much. We cannot say thank you enough to you for this. Thank you.
All right. Thanks very much, Doctor. Also, we are grateful, Dr. Ronnie, for giving in your time, and also we are grateful to AAR for giving in their personnel to come and educate the public on matters of health concern. Last time you took us through diabetes, and today you have taken us through asthma. We are also grateful. We know you are always busy, so we can't take that for granted. And also we thank you, our dear viewers, who have been with us from 10 a.m. up to now, and we are grateful to you. Have the blessed morning and also blessed afternoon at once. Thank you very much. Till we meet again next Thursday from 10 a.m. to 11 a.m. Thank you.